What is diarrhea? Reasons, symptoms, treatment, and what are the precautions of diarrhea? Diarrhea is a common digestive issue that involves loose, watery stools occurring more frequently than normal. It is often temporary but can be persistent or chronic, depending on the underlying cause. Let's go through each of your questions about diarrhea. 1. What is diarrhea? Diarrhea is a condition characterized by frequent, loose, or watery bowel movements. It can range from mild and temporary to severe and persistent, depending on factors like diet, health, or underlying conditions. Acute diarrhea typically lasts a few days, while chronic diarrhea may persist for weeks and often indicates a more serious issue. 2. What are the reasons for diarrhea? Common causes of diarrhea include infections, bacterial, viral, or parasitic infections, like E. coli, rotavirus, or giardiasis, can cause diarrhea. Contaminated food or water is a frequent source. Food sensitivities or allergies, foods like dairy, for lactose-intolerant people, gluten, or certain artificial sweeteners can trigger diarrhea. Medications, antibiotics, antacids containing magnesium, and certain cancer drugs can cause diarrhea as a side effect. Digestive disorders, conditions like irritable bowel syndrome, IBS, Crohn's disease, celiac disease, or ulcerative colitis often lead to chronic diarrhea. Stress or anxiety, high levels of stress can disrupt digestion, resulting in diarrhea for some people. Food poisoning, eating spoiled or improperly prepared food can introduce toxins or harmful bacteria that cause diarrhea. 3. What are the symptoms of diarrhea? Common symptoms associated with diarrhea include frequent, loose, or watery stools, abdominal cramps or pain, bloating or gas, nausea or vomiting, urgent need to go to the bathroom, fever or chills, in cases of infection. Dehydration. Signs include thirst, dry mouth, fatigue, dark urine, and dizziness. Severe dehydration, especially in infants or the elderly, can be dangerous. 4. What are the treatments for diarrhea? Treatment depends on the cause, but general approaches include rehydration. Diarrhea can quickly deplete the body's fluids and electrolytes. Drinking water, oral rehydration solutions, ORS, or electrolyte-rich fluids is essential. Dietary adjustments. Eat a bland diet, focusing on foods like bananas, rice, applesauce, and toast, the brat diet, which are easier to digest. Medications. Over-the-counter antidiarrheal medications, like loperamide, Imodium, or bismuth subsalicylate, Pepto-Bismol, can help, but they should be used cautiously, especially in cases of infection. Probiotics. Taking probiotics may help restore the natural balance of bacteria in the gut, potentially reducing the duration of symptoms. Antibiotics or antiviral medications, prescribed only if the cause is a bacterial or viral infection, respectively. 5. What are the precautions for diarrhea? To prevent diarrhea, try these strategies. Practice good hygiene. Wash hands thoroughly, especially after using the restroom or handling food. Eat and drink safely. Avoid street food, unfiltered water, and undercooked food, especially when traveling. Maintain a balanced diet. A diet rich in fiber, with limited processed or spicy foods, can support regular bowel function. Handle food carefully. Avoid cross-contamination by washing fruits and vegetables, cooking meats thoroughly, and storing food properly. Stay hydrated. Keep up fluid intake, especially in hot weather or while exercising. While mild diarrhea often resolves on its own, see a doctor if symptoms are severe, last more than a few days, or involve signs of dehydration. Persistent or recurrent diarrhea may indicate a more serious underlying condition that requires medical evaluation.
Thank you for watching. Please like, subscribe and share our channel, The Amused Notebook.